Well, February is Children's Dental Health Month. It's a perfect time to make sure your children receive the dental care that they need. Joining us is Dr. Ted Gargano, along with dental hygienist Deirdra Bishop, to tell us how to maintain healthy teeth. Thank you both for being here.
Thanks for having us
From
again.
Gargano Family Dentistry, of course.
Correct.
So, Doctor, let me start with you. When should a child be at the dentist's office?
All right, so we actually recommend that kids start coming to see the dentist around age 1, believe it or not. And that's mostly just to get them used to the environment. You know, there's a lot of scary looking things in the office, so we want the kids to be comfortable from an early age.
Right. And they must have teeth at that point?
Yes, they do. Yeah, they do. Definitely have teeth. So, you know, it's also a good way to help instruct the parents on how to help them brush. Obviously, they're not brushing their own teeth at 1. So we want to make sure that the parents know how to, you know, make sure that the kids' teeth
keep an eye on it. It's important. It's their responsibility at that point. And Deirdra, you brought kind of some props here. How do you make it comfortable for kids to not be afraid of the dentist?
You know, one of the things I tell all patients is we are all experienced with children. We've all either had them or worked on them, and the most important thing is to make a child comfortable. They don't want to, they're only picking up on fear if you're giving it to them. So we try to make them as comfortable as possible and make it as fun as possible.
And how do you go approach the babies and the little kids?
Carefully.
Who might just bite your fingers? I don't know.
Yeah, very, very carefully, and every kid is different. So, you know, everywhere from the first entrance into the room to when they leave, you have to, you know, put your kid gloves on is what we call it. Make sure that they're comfortable.
And do you recommend every 6 months at young age, or do you do more like every year?
Get them used to the regular 6-month checkup visit. So put them on a normal schedule, even though there might not be many changes that early on. Get them used to that twice-a-year thing that they'll have to keep up for the rest of their lives.
And reinforce the home care and the parents' ability to clean their teeth.
It's not easy cleaning a baby or toddler's teeth. It's quite challenging.
Yes,
I can tell you from experience, but they do get a big kick out of getting a new toothbrush and all the goodie bags that come with it, right?
Yep, it's a lot of fun.
Now, what would you say to a patient that says, you know, they're going to lose their first set of teeth? Do we really need to maintain them as much?
Yeah, it's pretty a common misunderstanding amongst parents out there, is that, you know, oh, they're just going to lose these teeth in a couple of years, no big deal. But actually, the primary dentition is almost just as important as the permanent dentition, because it's important in maintaining spacing and helping those adult teeth to come in when it's time.
And let's talk a little bit about fluoride, because I know it's kind of a hot topic. Some people are for it, some against it, but you're really kind of helping out your adult teeth when you prescribe it.
Yeah, so with fluoride, the main thing is to remineralize demineralized enamel, and the mineral content of enamel is called hydroxyapatite. And when you take fluoride, or you brush with a fluoride toothpaste, that fluoride ion then captures the demineralized hydroxyapatite, becomes fluoroapatite, which is actually stronger. So
we'll take your word on it.
Yeah,
so use the fluoride is what you're saying.
Indeed. Long story short.
Sure. And Deirdra, how do you make a child comfortable? So just bring me into a visit right now. You have a child who's kind of apprehensive. What's the first step?
The first thing is talking to the patient, the child. It's nice to have mom and dad there, but I try to make a connection with the child. I try to talk to them. I try to make them as comfortable as possible. Sometimes a child isn't going to let you do everything on the first visit. It's not going to happen. But the important thing is that it's not a scary experience, that they remember it was fun and that it wasn't anything to be afraid of.
There you go. Well, call you guys over in North Haven, Gargano Family Dentistry. You can learn more over at their website, garganofamilydentistry.com. Thank you both for being here.
Thanks again.
Thank you.
Sure.